Decades, fluoride has been added to most of our tap water to help protect against cavities. Now studies are addressing how much is too much fluoride and whether it can cause problems, particularly in infants and expectant moms. Joining us to share some insight is biological dentist Dr. Griffin Cole. Good morning, Dr. Cole. This is really good, but I have to ask
Good,
first, what is a biological dentist?
good morning. Thank you for having me, Megan. So a biologic dentist is very much like a functional medicine doctor in that we look at the whole person, right? So instead of just treating things in the mouth, we want to know the underlying causes of their symptoms. Why are they getting decay or gum disease or whatever? So we look at the whole body and spend quite a bit of time with our examination processes. We also don't work with any materials that we know are toxic to the human body. So we avoid things like mercury, nickel, and fluoride.
Well, that makes a lot of sense because what is the big concern about ingesting too much fluoride and really how much is too much?
So too much fluoride can affect most of our body's organs in a negative way. And now we know it affects brain function and activity. And we know this because the National Toxicology Program, which is a part of Health and Human Services, they looked at these studies recently to find out, is there anything to this? And they found absolute brain impairment, including lower IQ in babies who were born to pregnant moms who ingested fluoridated water during their pregnancy.
That is so scary. How are they able to measure the fluoride levels in expectant moms?
Yeah, so what they did was they looked at the level of fluoride in the moms who drank fluoridated water and compared it to pregnant moms who delivered at the same time but did not ingest fluoridated water. Both this report that was done by the NTP and the studies concluded that they saw IQ drops as high as 7 points in babies who were born to the moms who drank fluoridated water. So this is pretty damning stuff.
It really is. Now, since most of us kind of grew up drinking that kind of water, how much is too much?
So we're all getting too much, just so you know. I mean, even if
Oh,
you're in an
right.
area that doesn't fluoridate, and we know this because again, Health and Human Services had to lower the level that was allowed to be added to water supplies back in 2015, and they did this for a couple reasons. One was because they noticed that there were more and more children who were getting spots on their teeth. The spots are those white brown spots that's called fluorosis. That means they're getting too much fluoride. It was every two out of five children, so 41%. In addition, there's fluoride in so many other sources, right? It's in bottled drinks, it's in mouth rinses, toothpaste, it's in dietary supplements, and even many prescription medications. So it's really hard to avoid. They had to lower it.
So, how do you maintain a healthy smile without added fluoride in our water or the other substances?
Good, sound diet, one that is obviously low in sugar, but high in green vegetables, high in good fats, ample protein. That combined with good home care. I mean, brushing and flossing daily. And when you brush your teeth, spend a couple minutes. Really get them cleaned up on all your surfaces. Clean your tongue. If you combine a good diet with rich nutrient dense foods and basic home care practices, that combination is a home run. You'll get very few oral problems.
Well, this is a great segment. Very good kind of reminders, too. Where can we go and get more information about these fluoride concerns and if we want to find a biological dentist in our area?
So you can go to the International Academy of Oral Medicine and Toxicology's website. It's IAOMT.org, IAOMT.org, and you can find a biologic dentist, as you mentioned, from all over the country and the world. And we have a digital library of just so much information. It's unreal. You can find anything you want to know about oral medicine. It's a good
Doc,
resource.
thank you so much, Dr. Griffin Cole. We appreciate it.